Duplex ultrasound has been shown to be an effective non-invasive technique for the evaluation of the extracranial segments of the vertebral arteries. Spectral Doppler velocity data can be obtained from portions of extracranial vertebral arteries. A more reliable approach to assessment of the vertebral arteries is to initially evaluate the vessel near its midsegment or segment 2, the segment of the vertebral artery that courses cranially through the foramina to the transverse process of the axis. This segment of vessel is typically quite straight, with minimal tortuosity, does not have any significant taper or diameter changes, has no immediately adjacent blood vessels, except the vertebral vein, and has no significant branching segments that would make flow velocity measurements unreliable. In addition, segment 2 of the vertebral arteries is only rarely involved with atherosclerotic obstructive disease. Further distally, the vertebral artery may be interrogated using a suboccipital approach and transcranial Doppler techniques, but segment 3, the segment that extends from the artery's exit at the axis to its entrance into the spinal canal, and segment 4, extending from the point of perforation of the dura to the origin of the basilar artery, are generally inaccessible to duplex ultrasound during an extracranial cerebrovascular examination. Abnormalities in vertebral artery flow hemodynamics caused by stenotic lesions can be detected readily from the spectral Doppler waveform characteristics and flow velocity data. Visible narrowing on color flow examination accompanied by high-velocity color aliasing and the mosaic pattern characteristic of poststenotic disturbed flow are findings indicating vertebral artery stenosis. No velocity criteria are available to define the severity of vertebral artery stenosis. Ultrasound diagnosis of stenosis at the vertebral artery origin is complicated by the frequent occurrence of considerable tortuosity in the proximal 1 to 2 cm of the vertebral artery.